Thank you for all coming today. I am a northerner myself, still live on the north, though I do travel over the Harbour Bridge to go to work, so hopefully that's acceptable. They say that we're an insular lot, those of us that live on the north. I'm really excited to talk about this particular area. As a neuropsychologist working with older people for many, many years, I always felt as though we weren't doing enough. Has anyone here ever encountered a neuropsychologist? No. You don't want to. We have awful people that spend hours with our clipboards testing your memory and doing lots of very detailed tests of all different parts of the brain to try and work out what's going on when someone presents with early cognitive decline or dementia. But I think the thing that we really have to do is we need to start doing more about it. We have to, A, help people that do have cognitive impairments to live in the community for longer, and B, we have to try and prevent brain ageing and different forms of dementia. And that's why I decided I didn't want to work in a hospital anymore. I wanted to actually start a research program where we could look at different causes of dementia and what can we do about it. So I do look into many different types of risk factors for dementia, and Sue's already told you about some of those, but some of those that I've been interested in particular have been depression, which I'm not talking about today, but I will touch on. Also, my team are interested in physical activity and nutrition. Sleep is one that I'm talking about today. It hasn't been captured in all of the risk factors that have been documented in the literature. It's very new, and so we're really just unravelling the secrets of sleep and how they may contribute to the brain's health. And of course, brain training is the other one. So I'll get started. I hope you've all got your thinking caps on because I have 15 minutes to cover 3 topics, and I normally do one in about 25 minutes. So by all means, come and grab me afterwards if there's anything that's unclear. So first of all, I wanted to talk about sleep. So first, a show of hands. Anyone here have problems with their sleep? Okay, so maybe about 40% of you, so you're all healthy. So about 40 to 45% of healthy older people do complain about having difficulties with their sleep. So our sleep does change as we age, and it's very important to understand that when we're thinking or worrying about our sleep. Why isn't our sleep like it used to be? It does change with age. So this is what we call a sleep hypnogram. This is a hypnogram of a young healthy person, and what happens when we sleep is we have 90-minute cycles. We start off with these black periods here, if the pointer works, yes, and then we go down into lighter stages of sleep and then into nice deep sleep cycle, and then we cycle back up and we have a little bit of dreaming sleep. For the next 90 minutes we do the same, and then again we start to have less of this deep sleep towards the later parts of the night, but we start to dream more, so which is why we often wake up after we've been dreaming. We remember our dreams. But what happens to sleep when we get older? Actually, from about the age of 40, our sleep starts to change considerably, and it's what we call architecture. So starting here again, the one on the right, you'll see that we have this period of awakening. We go down into this very light stage of sleep. You'll see there are many more of these light stages of sleep throughout the night. So we often feel as though we're not asleep. We are asleep, but it's not very good deep sleep. It's quite light. So we have lots of those. We also have less of this deep sleep, so less of the purple and the orange and the blue bars. And you'll see we also have less dreaming sleep and also more of these black periods on the right-hand side, so we have more awakenings during the night. So that's very typical of our sleep as we get older. Of course, this also seems to occur with shorter sleep. We seem to need less sleep than we used to. We tend to get a bit more sleepy during the daytime, and we also shift to going to bed earlier and waking up earlier. Has anyone experienced that as they've got older, they tend to just wake up earlier? So it's called a circadian advance. So our circadian system is very important in governing our sleep, and essentially that works because when the lights go down, melatonin in our brain secretes, that's just like the sleep hormone, and when the lights go on, it suppresses again. And melatonin is a hormone that is secreted in the brain and then regulates our sleep. And it's important to know that because we can actually influence our sleep just by how much light we have. If we get up in the morning, we have lots of good light exposure, that's a really good thing to do to keep that circadian rhythm working. So the two things work together. The other important thing about sleep to understand is we get what we call a sleep pressure. It's called a homeostat, the sleep homeostat. So after long periods of awakening, your pressure for sleep builds up during the day, so that's when you get really sleepy at night time. But if you go sleeping in the daytime for a really long period, or even in the evening, you're not going to have that same pressure. So what you do in the daytime is really important to influence the time of sleep and the quality of sleep that we have in the nighttime too. And I'll tell you a bit more about that when we talk about napping. And so why do we think sleep is important for a healthy brain? It's really important because a few years ago we discovered that sleep actually clears the brain of toxins, of waste, and of beta amyloid, which is the protein that's involved in Alzheimer's disease. So there's been some very nice experimental studies in animals, but also in humans, showing that if you deprive people of that nice, deep, slow-wave sleep, you experimentally manipulate that, you'll produce more of those levels of beta amyloid if you take a sample of what we call cerebrospinal fluid from someone's spinal cord. Basically, you can get these levels of this toxic kind of chemical. So it's really important to understand that sleep is not just a product of other things, it's actually really important for maintaining the integrity of our brain. It also plays an important role in regulating our immune system and in inflammatory processes that go on in our brain. And it also is important in laying down new brain cells. So we do know now that there's a part of the brain called the hippocampus, which is the seat of memory, and is also the part of the brain that's involved very, very early on in Alzheimer's disease. And sleep actually facilitates the generation of new neurons in the hippocampus. And that's, again, another remarkable discovery that we didn't know before. It's also important for laying down our memories. So what happens when we take in new information in the daytime, our memories are kind of stored somewhere temporarily, and then when we sleep, it actually lays our memories down. It takes our memories out of our hippocampus, puts them somewhere else in the brain, and then frees up our brain so that the next day that we can take more information in. So it has some really important functions for the support of our brain in the short term, but also in the long term. Unfortunately, sleep problems are more common in people at risk of dementia. So I said about 40% of people may report just having sleep problems if they're healthy. If they are in an at-risk stage of dementia where they do have cognitive impairment, but they are still very functional, so Sue was talking about remaining functioning is an important distinguishing feature of someone that doesn't have dementia. You can have some problems with your memory or with word finding and have what we call mild cognitive impairment, but you do not necessarily have dementia. But we do find even in those people that their rate of sleep problems is much higher. About 65 to 70% of people would have problems with their sleep. And in dementia it's more common again. So we have reversal of the day-night cycle. We have agitation sometimes. We have people that might wander at night time. But we also have lots of daytime sleepiness, lots of napping, and really, really poor sleep quality at night time. The other big thing about sleep, which is important to think about because it's a modifiable factor, is obstructive sleep apnea, which is essentially snoring. Any snorers here? There's got to be some. Well, we know that that sleep disordered breathing, even in very mild forms, becomes more common as we're older. And what happens if we're snoring and actually gasping for air, having an apnea or hypopnea, a partial cessation of breathing while we're sleeping, we not only fragment our sleep so that we don't have good solid sleep, but we actually starve our brain of oxygen, and that in turn creates damage in our brain. So it's really important if you snore or your bed partner snores to go and have that, talk to your doctor and go and have it investigated if need be, particularly if you have symptoms of daytime sleepiness. That's something that can be treated. There is a gold standard treatment for that. People don't usually like it, the Darth Vader mask, but it's very, very successful, and it's one of the best things you can do for your brain if you're a snorer. So some other factors affecting sleep. Exercise is a big one, so Sue's already mentioned that. Napping is another one. So if you're going to nap, if you need a little bit of sleep in the daytime and need to take that edge off, best to have the nap just after lunch. If you have a short nap of about 10 minutes, that's okay. You'll get benefits for a couple of hours after that, so you might feel your mood's a bit better, not so grumpy, and also you can, feel a bit more alert for things. If you have a deeper sleep, a bigger sleep, so you might sleep for 30 or 45 minutes, you'll go into that deep sleep sleep period. And that means that when you wake up, you will feel a bit groggy. Does anyone know that feeling? And you go, oh, why did I do that? Why did I have that sleep? Well, that's called sleep inertia. And that's because we've actually had some of that nice restorative deep sleep. And that's okay to do that if it's just after lunch, so the siesta kind of period, 1 or 2 o'clock might be the period that's right for you. But do remember that it counts in your total sleep time at night time. So don't expect to have a nice big 6 or 7 hour sleep in the night time if you're going to have a nap like that all the time. It can be helpful to have a nap, particularly if you need to go out at night, you need to go to a family event, you don't know how you're going to stay awake. So it can take that edge off. You've actually fulfilled some of that sleep need or sleep pressure, and so it gives you then a boost right through to the night time if you have a 45-minute nap about 2 o'clock or so. Other things that can affect sleep are depression, our expectation of sleep, lots of medications that we take, and of course lots of different medical conditions as well. And these slides will be available on the website if you wanted to take any of those down. So what are the top 10 tips for healthy sleep? Well, if the first couple are kind of interrelated. So depression or depressive symptoms are one of the biggest risk factors for having poor sleep. So in all of the analyses that we've done of sleep, one of the biggest predictors is not even clinical depression, but just having depressive symptoms. Do people here have a reasonable understanding of depression? So it can be different in older people. So there may be a loss of interest or pleasure in things that you might have found enjoyable. There might be sadness, there might be low mood, there might be irritability, there might be preferring to socially isolate. But you can also get lots of gastrointestinal symptoms in depression in ageing that are very different to how they may present in younger people, and also anxiety. So we may see more of these, what we call mixed depression anxiety symptoms that occur together. As Sue said before, depression is important in and of itself as a risk factor for dementia, and so it's really important that we treat it. Studies that have looked at people that do not have depression treated show they have a much smaller hippocampus, that part of the brain that looks after our memory. Whereas some of the antidepressant medications can be helpful, or even psychological strategies which you can get on Medicare. You can actually get bulk billed on Medicare access to psychologists that maybe do cognitive behaviour therapy, for example. Keeping physically active is not only important for our bodies, but it's also important for our sleep. If you were physically active in the daytime and mentally active, you'll have a much better quality deep sleep than if you're just sitting around, or if you're not actually doing anything useful with your brain. You need to keep it active, and that in turn will ensure we have that nice deep sleep, which is also where all the restoration and the clearing of the toxins and waste occurs. And it's important again to think about your sleep expectations. So, okay, I haven't had a great night's sleep tonight. The worst thing you can do is keep dwelling on it, and because it actually contributes to having more poor sleep the next night. So it's important to think about, what is it do I want from my sleep? What time, do I need to be going to bed? If I'm having a nap in the daytime, does it really matter if, I'm not having a good night's sleep that night, as long as I'm functioning fairly well the next day? So the more we catastrophize about our sleep problems, the worse the sleep problems seem to get. So there's a bit of a vicious cycle. As I said before, melatonin is really important to think about in terms of it being suppressed during light. So very important that you get up in the morning and have lots of exposure to light in the daytime. Open the blinds, go for a walk, and keep that body clock ticking on time. There's other things that are linked to the body clock ticking on time, including behaviour when we eat and do all those kinds of things, all feed into the circadian system directly. And then some people find that they're really having difficulties getting to sleep at night. Even taking melatonin can be prescribed from your GP, and can be a slow release, can actually help people get off to sleep, and much better than taking sleeping tablets. So sleeping tablets like the benzodiazepines, anything with the PAM or the hypnotic still knocks and things, are not a good solution for sleep in the long term. They will offer short-term benefits, but they're not advised for older people. They contribute to cognitive problems, to confusion, to falls, and they actually don't work. They are addictive, and they're not as effective as actually looking at using more natural ways of correcting sleep-wake problems. I've already talked about naps, so it's important just to know the timing of nap and the duration of nap will impact on your sleep. Talked about sleep apnea and medications. Some medications like beta blockers, for example, can affect your sleep. Caffeine, of course, does. As you get older, your sensitivity to caffeine changes, so you may find that you can't have any caffeine after, say, 4 o'clock or 12 o'clock without it impacting on your sleep. Alcohol, of course, alcohol's a great sedative, isn't it? Gets us all off to sleep. Well, it can be okay if you have just a small amount, like Sue said, but the problem is if you have too much of it, it then disrupts the architecture of your sleep. So I don't know about you, but I've had a few nights where I've had too many and then I've woken up at 2 a.m. absolutely wide awake and can't get back to sleep again. And that's what it does if you have too much of it. So it's important you do stay within those 1 to 2 drinks kind of guidelines. After you've tried everything, if you wake up in the middle of the night and you really can't get back to sleep, you need to understand that when you do wake up, you'll wake up from REM sleep most commonly. And it's usually around 2 o'clock in the morning, 3 o'clock in the morning. And when you wake up from REM sleep, that's our dreaming sleep. And our brain is wired. It's like when you're wide awake. So if you wake up from REM sleep, it's important to allow yourself a good 20 minutes before you can even expect to get back to sleep again, because that's what your brain has to do. It's not the same as waking up from a deep sleep where you just kind of doze back off again. So it's important to remember that if you don't go back to sleep after 20 minutes, do get up, don't lie in bed, because then you'll start thinking about everything you could have done, should have done, and all the rest of it. So you're better off to get up, go into another room, keep the lights dim, don't do anything too stimulating for the mind, and after a while you'll start to feel bored and you go back to bed and you'll get back to sleep again pretty quickly usually. If you've tried all of these kind of methods, I guess, for improving your sleep and nothing helps, then I would suggest that you go and talk to your doctor and even consider, talking to a sleep physician or a sleep psychologist who can look in more detail and do some more analysis of the pattern of sleep, keep a sleep diary, and also have other investigations. You can have formal overnight sleep studies to look at the efficiency of your sleep and if there are other sleep disorders occurring. So I'll just quickly go through exercise. So as Sue said, exercise is a big component of dementia prevention that we're all pretty much focused on. Even if you have dementia and you exercise, your rate of functional decline will be much lower than someone that's taking one of the dementia medications. So it's the best thing you can do for a person with dementia to stop them from losing their functional abilities. And that's what we want to do, right? We want to keep people functioning as well as they can for as long as they can. So exercise is really important. Interestingly, all of these risk factors for dementia, my rates are slightly different to Sue's because we must have used either US or UK or the whole conglomerated thing, but the point is a third of the risks for dementia are due to these things that we can modify. And all of these things, diabetes, hypertension, physical inactivity, obesity, and depression, all benefit from exercise. So it's certainly not going to do you any harm by tackling this. And the rates of inactivity for older Australians are astounding. So in the 50 to 64-year-old age bracket, 58% of people are not exercising at the levels they should, and this increases to 61% and then 75% for those that are over 75. In the over 75 bracket, a third of people are completely sedentary. And we know that even in people that have disabilities, exercise is really important. So unless you're lying in a hospital bed completely unable to move, there are certainly things that can be done in terms of exercise in the home environment. And the benefits go beyond the brain, so right throughout the body. Exercise has been basically hailed as the wonder drug in terms of its capacity to treat many different medical conditions. And there are lots of mechanisms by which they contribute to improving brain functioning, including increasing the flow of blood to the brain, also important for these protective chemicals in the brain that facilitate the new growth of cells in that part of the brain, the hippocampus. So they're important for these things called neurotrophins. And also they're associated with reduced inflammation in the brain and less oxidative stress in the brain. So these are all the bad things that we shouldn't be doing. And Dave will probably talk about diet, but diet is another one that impacts on these levels of oxidative stress and inflammation. So does exercise help our cognition? If we start exercising now, will it help? Well, the answer is overwhelmingly yes. Everyone should start today exercising. So it's hard to do sometimes, but we do have to try and do as much of it as we can, and I'll go through that. But if we look at the data that actually links exercise to better cognition, it is, in general, very, very positive. So one large analysis of data pulled all different studies from 24 randomised controlled trials, which are the gold standard trial for looking at if something works, as well as 21 studies where they followed people up longitudinally, and they found that if people exercise at the rate they should, we can prevent, have a 40% lowered rate of dementia. So that's quite astounding, really. If we look at what functions improve, exercise seems to be associated with less shrinkage of the brain over time, but also better memory and better functioning, cognitive function generally. So quicker thinking, better attention, better word finding, all of those kinds of things. And aerobic and resistance training or muscle strengthening seems to be the best type of exercise that you can do, and I will go into that. One study, for example, in the US followed older people over 65 for 6 years and found that people that exercised at the rate they should had a 32% lower rate of dementia. So this was a very well-controlled trial that also followed people longitudinally. So what should you do? Does anyone know how much exercise? Give me a number. How many minutes should we be doing a week? How many? 30 a day, yeah, I don't know who said that, but that's spot on. So we should be doing, in terms of aerobic activity, probably at least 30 minutes of what we call moderate intensity activity. So we want to get the heart rate going. It doesn't have to be at the point where you can't speak. You should still be able to speak, so that's moderate intensity, for at least 5 days a week. And you can actually add it up. So if you have 12 minutes of that kind of exercise and then you want to add on another 12 minutes later, then that is cumulative. It does actually help to add it up. Or if you're one of those people that does do marathons or likes to do vigorous exercise or swimming, then you can have 20 minutes a day for 3 days a week. But it's important to do the muscle strengthening exercise too. Oh, sorry, before I say that, I should say there is a lot of interest at the moment in what we're calling this high intensity interval training. So it is actually going, hell for leather for about a minute or two on the pushing yourself as hard as you can, and then you can actually stop and kind of recompose yourself and get ready for your next interval. And it's been shown that that has particular benefits for the brain. There's some nice work actually being done at the University of Sydney looking at that as well. Muscle strengthening is also important, not actually just for our muscles, but also for our brain. So there's been direct evidence linking doing resistance training to benefits for cognition and for brain functioning, and also for sleep. And flexibility is important, certainly important for maintaining functioning, does reduce falls and also improves people's what we call activities of daily living, so being able to carry out your usual tasks and things. There's not as much evidence or good trials linking flexibility training, Tai Chi, yoga and that kind of thing to cognition. That's not to say it doesn't help, but we just don't have enough evidence yet to really say that it's helpful conclusively. So last up, brain training. Anyone do any brain training? Yes? One taker? Got a few? Okay. Well, brain training is a fairly new area, and it's a little bit of a murky area because there's lots of, commercial money, companies making lots of money out of people, claiming all kinds of things. So it is a bit of an area that we need to be careful about in terms of marketing versus evidence. What is brain training? Well, it's like a gym for the brain. It's working the brain out using different tasks. We tend to get people to do repeated exercises using specific skills, such as those targeting memory. And we can either try to directly restore a function, such as memory, or we can try and use other ways to get around memory problems so that we can support memory, for example. So we can either restore functioning or we can compensate for loss in an area of functioning. We can use computer-based tasks, so there are some specific companies that have developed computer-based programs specifically for brain training. But the other thing is we can also use strategies to help you in your daily life remember the news better, or remember someone's face better, or remember something that you just heard, or remember what you have to go and learn at the shop. So they both have a role to play. Diaries and using phone reminders and things are also very helpful just in everyday life, and using whiteboards and stuff. So they're all strategy-based kinds of methods. And so what does cognitive training do? Well, we actually know that if you look at people that have a higher level of education or more occupational complexity, they can withstand more Alzheimer's pathology in the brain without showing any symptoms than someone that hasn't had that same level. So basically it gives us what we call cognitive reserve. It gives us the ability to be, a bit resilient against this Alzheimer's pathology in our brain and still maintain our functioning. So cognitive reserve is a concept that's been very well studied. And it's been suggested that if we do keep our brains active at the levels that we should, and mental activity throughout life is associated with a 46% lower risk of dementia. So there's good evidence around cognitive reserve. What we're now trying to do is say, well, we know this now about cognitive reserve. How do we actually use this to build the connections between the brain? So we need to strengthen the connections that we have there. And you'll see here in this picture, this is a picture of the brain. It's very small, but that's the hippocampus, that part there. And this is it very, very small, a small component of it. And what we're wanting to do with cognitive training is take this neuron, I guess, that's very depleted. It's like a tree that doesn't have any branches, and we want to grow these branches, or dendritic arborization we call it. Its ability to connect with all of the neurons better. So we want to strengthen these connections. And so there's evidence that cognitive training does work. It does work in healthy older adults. It's actually been shown probably that to have the most benefits in healthy older adults with some really big international trials in this area. It also works in people that have mild cognitive impairment in terms of improving memory. It also works in Parkinson's disease and also in people with depression. And we're now starting to try and work out, well, what's cognitive training, if it's done well, and in research studies, what's it actually doing in the brain, and getting some evidence that it is actually changing the network structure. And importantly, it doesn't hurt, so you may as well give it a try, right? It doesn't work for people with dementia, so it's very important to be clear about that. If you have a colleague or loved one or friend that has dementia, it doesn't work. There's no good evidence that it works. There are other things that can be done for people with dementia in terms of using goals or improving their memory or using strategy training approaches, but these cognitive computer methods don't seem to show any efficacy in people with established dementia. And so what do you need to do if you're going to do brain training? This is the golden question, right? What do you need to do? Well, unfortunately, most of the studies so far show that the most evidence is around those things that are being done in a research environment or in a group-based setting. So the council, what we need is a room full of computers, and then we need to be able to provide a therapist to come in who understands brain training, and if we deliver it 3 times a week, it's probably got the most benefit, so an hour at a time. You need to challenge the brain. If you've always done crosswords, don't do more crosswords. You need to give the brain something really difficult to do. So some of the computer-based approaches are really good for that, because you can actually start with something that you are a bit good at, get you involved in it, and then you can actually build up from that. It is a bit like physical exercise. You do need to keep doing it. So it needs to be at least 30 minutes at a time, preferably an hour, 2 to 3 times a week. And we believe, and we've done our own trials showing that it's probably better if you combine the computer-based training with teaching older people strategies about how to improve their memory, but also targeting other things, exercise, depression, sleep. And this is a little bit like the finger trial that Sue told you about, that there is evidence if you use this multifaceted approach to dementia prevention that you probably do have the greatest capacity to delay or at least slow dementia. We don't know definitively yet if we can actually cure dementia using these prevention approaches. And this is just some examples of some of the different commercial brain training programs that do have an evidence base around them. So Lumosity, which is nice to do and is quite fun. Brain HQ, for example. Some of them do charge you, but if anyone's interested in brain training, feel free to drop me an email and we can give you some more information about what might be effective. As I said, you can also use other things that take the strain off the brain. You can use memory reminders. Diaries are really good, like a week to a page. You can write things down at the time, which also helps you to remember them because you've written them. So you've heard it, you've seen it. You probably don't even need to go back to your diary, but it's there if you need to. You can put to-do lists in there and you can use post-it notes and things. And there's lots of different other internal strategies. And when we give the long version of this talk, we usually go through a lot of those exercises of how to actually, can you chunk things or rehearse things to help you remember them better or help learn new faces, but I can't go into those now, sorry. So in summary, sleep is really important for the brain. It is emerging as the new risk factor. It does have an important role to play in the brain. It seems to be linked to dementia. It's associated with faster decline if you've already got dementia. It's best to think about managing your sleep using non-drug methods and certainly talk to your doctor if you find that using some of these techniques doesn't actually help. Exercise has been hailed the wonder drug. If anyone says to me, what is your top tip for preventing dementia, then I usually say it is exercise. But there are a few questions around exercise in the literature at the moment, and I think, as we say to everything, right, we need more research. Brain training definitely has beneficial effects for healthy people, people with mild cognitive impairment, but not dementia. Need to do it at least 3 times a week, keep the brain challenged. And as Sue said, it's really important that you do engage in other things, learn a new musical instrument, stay engaged in your community, be socially active. Those things are very, I guess, understudied at the moment, but we do think that they have a really important role to play in maintaining independence and preventing dementia. We do have a clinic at the University of Sydney, which is called a Healthy Brain Ageing Clinic for anybody aged over 50. We see people that have concerns about their memory. We need a referral, a GP referral, if you'd like an assessment for your memory. We have nasty people like me, neuropsychologists, but we also have nice doctors as well that do those assessments. But we're actually really looking for people that don't have any concerns about their memory either, because we usually say to people, come along to the clinic, and they say, oh, I don't have any concerns about my memory, but then it turns out that they do. So we're really looking for people that feel as though that their brains are going pretty well, because we find that they're the hardest people to actually get into these kinds of settings. Our clinic is free. We give people a report. We do brain scans and sleep studies and all kinds of things. So if you're interested, our details are there, and of course this will be available on the website. Thank you.